Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy or you're just tired of not feeling like yourself, this space is for you. Welcome back. It's awesome to have you with me today. Thank you for taking time out of your schedules to listen to this podcast. I'm excited to bring you information on an emerging topic, and you've probably heard about it by now. It's called long COVID. And obviously, 5 years ago, 6 years ago, when COVID hit the world changed in many aspects. One of those aspects is a new onset of something called long COVID. Whether you've heard about it or not, I kind of want to just define it and then give you some real world perspective on it because I've treated it from probably the beginning. And uh, this is from the Long COVID Foundation, which is a great nonprofit organization dedicated to helping those with long COVID. So, just what is it really? This is directly from their website. Quote, the World Health Organization states long COVID can affect anyone exposed to SARS-CoV-2, regardless of age or severity of original symptoms. The definition of long COVID is the continuation or development of new symptoms 3 months after the initial SARS-CoV-2 infection, with these symptoms lasting for at least 2 months with no other explanation. This is a major emerging problem worldwide. What are the symptoms that can emerge 3 months after that initial infection and last and kind of linger? Then the issue is a lot of these are multi-system, meaning it's not just one symptom, it's many symptoms. Common symptoms of long COVID, again, this is quoting from Long COVID Foundation's website. Common symptoms of long COVID can include fatigue, shortness of breath, and cognitive dysfunction. But more than 200 different symptoms have been reported that can have impact on everyday functioning. Studies show that around 10 to 20% of people infected by SARS-CoV-2 may go on to develop symptoms that can be diagnosed as long COVID. Although the exact numbers of those living with the condition are uncertain, it's believed that more than 17 million people across the World Health Organization European region may have experienced it during the first 2 years, and there are estimates that over 23 million people alone in the United States may be experiencing this. Stats are difficult in this situation due to reporting systems and just the far-reaching problem. It took them a long time to even get this recognized. So at the beginning of the pandemic, the reason I got into this is so over probably 10 to 15 years ago, I started to pioneer a food allergy treatment. Okay, so what does food allergy have to do with long COVID? Well, we pioneered a food allergy treatment that not a lot of people recognized at the time. And a lot of people would come to see me because I would tend to think outside the box and perhaps look for things that other people wouldn't. And with my background in immunology, patients, once they started experiencing some of these long COVID symptoms, they would go to their doctor and often not be believed. They would be discarded or not really validated. And so patients started coming to me saying, hey, we're having all these symptoms. Nobody's doing anything about it. We know you think outside the box. We know you have a background in immunology. Can you help? And I lead with compassion. So when I hear these things and people not being heard, not being validated, my heart goes to them. And it's like, yeah, let me do my best. I'll try. So I started learning about long COVID, started evaluating for it. And developed kind of a way, some diagnostic tests, but also some treatment patterns. And honestly, this has absolutely evolved over the last several years. What I do now is completely different than what I did 3 or 4 years ago, because it's emerging. It's emerging before our eyes, and as we've got more information, more science, more research, I will continue to adjust and adapt. And anyone that says they know everything about this is just wrong. We don't. And part of my thing is a lesson that I learned years ago from one of my mentors was the best teachers of medicine or the best teachers of immunology are not textbooks, they're the patients. And I think we really need to listen to patients, not marginalize, not invalidate what they're saying, but listen to them. They will teach us what's going on, and they will tell us what the diagnosis is if we listen. And that's kind of where I started with this, is just listening to what they were experiencing. And I didn't really have much answers at that point. It was just validating them and saying, you know what, you're heard, and I do hear you, and we're in this together. And can we work together as this new science is emerging? But it is a fast growing issue, and it's an important issue because it affects so many people, and it can be so debilitating. And the nice thing is, over the course of time, it is now recognized. There is now a diagnosis code for it. We are learning more and more about it. We can actually understand it more from blood tests, from testing that we're doing, and we actually have at least a framework of how to approach these patients in terms of treatment. What's really interesting is if you get on like a Facebook group or a social media group of long COVID, so many of them are so desperate because they haven't been heard for so long. They'll pose a question about, have you ever experienced chronic fatigue? Have you ever experienced brain fog? Have you ever experienced this or that? And you're going to get 100 different answers. And one of the things that I've learned with long COVID is there are so many symptoms, there's so many different nuances to it. What works for one person may or may not work for the next person. The other thing that I have learned through this is we could do an evaluation at one particular given point in time, but that doesn't necessarily stay the same. It can evolve, it can change, things can develop, it can progress. And so we have to do sometimes repeated evaluations on these patients. And we have to keep an open mind to what they're experiencing and being willing to reevaluate, re-examine, listen to them, hear them, pivot, add new treatments, do different things to try and help this population as while we try and discover more and more about it. But there is definitely at this time what I've been able to do over basically 4 or 5 years of experience, and also collaboration with other like-minded doctors of mine, and these nonprofit groups, which are so helpful. These nonprofit groups are patient advocacy groups. We can learn a lot from listening to them, but we've developed a certain way that we can diagnose, and also from the diagnostics have a starting point for treatment and then pivot as necessary, because not everyone's the same. And again, as the Long COVID Foundation's website states, there's over 200 symptoms that people may experience. Some of them are more common than others, as was mentioned: brain fog, chronic fatigue, shortness of breath, uh, what's the other one? Cognitive dysfunction. They can also have reactivation of viruses, altered taste of senses of smell and taste, or an altered sense of smell and taste. So, all kinds of things may emerge with this group. And there's different pathologies involved in what may be triggering these symptoms. And so we're now at a point to where we can do better diagnostics, but also tailor treatment to that individual. Instead of just giving them the whole kitchen sink, we can now tailor things a little more specific and be more strategic in our approach with the patients. So if you or a loved one are struggling with these types of symptoms, uh, call us. Let us know. There's also some other symptoms that are overlapping with a group of patients that have had what's called vaccine injury or post vaccination syndrome that we're going to discuss in a different podcast. But just to kind of list some of the, to recap and also list some of the symptoms from long COVID and also post vaccine syndrome, just so you have an idea, people will have mast cell disorders, POTS, GI problems, meaning abdominal pain, bloating. They may have insomnia. They may have something called angioedema. They may have significant immune dysregulation or immune deficiency. Some of these patients may have autoimmune disorders, such as Sjogren's, rheumatoid arthritis, lupus. They may have lung symptoms. Again, the brain fog and fatigue or post exertional malaise is one of the things that we talk about, meaning they try and go out and exercise, and all of a sudden they get so fatigued that they're laid up in bed for days on end. They may have something called dysautonomia, where the nervous system isn't working quite right, small fiber neuropathies or chronic headaches. So these are all common symptoms of long COVID. There's also some overlap with, again, uh, something called post-vaccine syndrome, where these patients are had COVID vaccine, but also had symptoms from that. That's going to be treated on its own. So there's overlap between long COVID and post-vaccine syndrome, but there's also some very distinct characteristics amongst these. So if you're experiencing any of these types of symptoms, again, know that you're heard. You are heard by me and several of my colleagues. You are validated. You absolutely need help and you need a voice, and we're here to help. We're here to properly evaluate you. We're here to offer treatment options, and we're here to walk this journey with you. Um, you're not going to be discarded anymore. And this is going to continue as we kind of work through the ramifications of COVID. So, if, again, you or a loved one are dealing with these types of symptoms, let me know. Leave a comment. Let me know what you've experienced or what your experience have been. How has your interaction been with your doctor? Have they heard and validated you? Did they do some diagnostics? Is there a treatment plan in place? What more can we do for you? Uh, but just to wrap up, we see these patients day in and day out. And if you think there's some way that I can help you, please let me know. Go to our websites, myimmunenetwork.com or drdugjones.com, and let us see if we can help you or provide you some resources so that you can work with your local doctor to get you the help that you need. This will be an evolving science, an evolving and changing diagnostic and treatment paradigm. But it's important that we keep an open mind, that we collaborate, and that we work with each other. So that's long COVID. And hopefully it sheds some light on perhaps what you've been experiencing or what a loved one's been experiencing. Until next time, look forward to seeing you again. Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.